Hey guys, and welcome back to That's What You Think. Now, this week we are going to be talking about something a little bit more serious than our usual content. I've been requested to do a video on how to recognise heat exhaustion and heat stroke in children. I personally feel that this is a really important video to make, hence the reason why I've decided to do it. There are lots of symptoms that parents may not know about or may not know to look for. So hopefully you guys will find this video nice and helpful in this really hot weather that we've been having. But for now, roll the titles.
That's what you think.
Okay guys, so like I said, this week we're going to be talking about how to notice heat stroke and heat exhaustion in children. It is quite difficult. A lot of the time you can't sort of really tell, or they're too young to tell you, or there's symptoms that you just don't know to look for. So we're going to be running through a few of the symptoms. We're going to start off with heat stroke, and then I'll run you through all the symptoms for heat exhaustion as well, and then we'll go through some of the little tips on what to do if you suspect that your child is suffering from any of these symptoms. Okay, but first of all, let's jump onto heat stroke. Now, there's quite a few symptoms that you can look for in this. So we're going to start off with a severe headache. So obviously if you have got a very young child and they are too young to tell you what's wrong, a headache's a really hard thing to diagnose. So do just be aware of how they're acting. They may be holding their head, they may be not kind of wanting to move about too much. So obviously you just use your judgment on that. We've also got weakness and dizziness. So if your child is stumbling around or they are too weak to sit up, that could be a very good sign that your child has got heat stroke. Okay, so do just keep an eye on that. We've also got confusion. Now, confusion is one that a lot of people don't really know about. Now, confusion can be a symptom of quite a lot of illnesses, but if there has been extremely hot weather or your child has been out in the sun, confusion can be a sign that your child has got heat stroke. So please do just be aware that this could happen. Okay, now the next one is fast breathing or heartbeats. Now, if your child is breathing faster than usual, or they've got a irregularly fast heartbeat, this could mean that they are also suffering from heat stroke. Although heat stroke is one of the things that they could be suffering from, this is actually quite a very important symptom. So if your child is suffering from this, then please do get medical attention as soon as you can. Okay, now the next one is loss of consciousness. Okay, i.e. sort of fainting or passing out. Obviously, if your child's fainting and they're passing out and they've been out in the sun, you can pretty much guarantee that they've got a sun-related illness, but it could be a symptom of an underlying problem. So obviously, again, really important to get that checked out. We've also got seizures. Now, seizures is probably one of the less common. However, it does happen for a lot of children. If you've got heat stroke, even in adults, seizures can happen. It's just caused by the body's core temperature heating up too much, and it is affecting all of the muscles and everything in your body. Okay, so please do just be aware of that. And if you do suspect that your child is suffering from these, then please do get that checked out. Now, we've got little or no sweating. Now, a lot of people think that heat-related illnesses, people are going to be profusely sweating, especially children. It's not true. Actually, with heat stroke and heat exhaustion, and a lot of other heat-related illnesses, you don't actually sweat. So please don't be looking out for a lot of sweating if you do suspect that your child has got heat stroke. All right. Now, the last ones are really important. So we've got flushed skin, which basically means it's redder than usual. Obviously skin will be hot to the touch, but it will also be dry. It won't be wet. Again, heat stroke patients don't tend to sweat, okay? And the body temperature will rise to 105 degrees Fahrenheit or above, which is about 40.5 degrees centigrade, but it won't be less than that, okay? It will be above that, so obviously do keep an eye on your child's temperature if they have been outside. Now, we're going to move on to heat exhaustion now. Again, I'm going to list some of the symptoms. Don't worry if you have got a child who you think is suffering from any of these. In a very short while, I'm going to go through all of the things that you should be doing to make your child more comfortable while you wait for medical attention. Alright, but for now, let's move on to heat exhaustion. So we've got obviously an increased thirst. So you know yourself as a grown-up, if you're really hot, you get thirsty and you do need to drink a lot more. This is a lot truer with heat exhaustion patients, especially in children as well. They will drink lots and lots, okay? Again, we've got weakness, so if they are struggling to sit up or pick things up, that could be a symptom, but also extreme tiredness as well. So if they are lethargic and they are laying down, they don't really want to do anything and they just want to sleep, just keep an eye on that. It could just be the heat, but it could actually be heat exhaustion as well. So it's really important just to keep an eye on that. I mean, obviously let them sleep, but if you are worried, then do just ring your doctors. Again, we've got fainting and muscle cramping. Now, a lot of heat exhaustion patients will get muscle cramps. Again, it is just to do with the heat. It's to do with how hot that their core temperature is. So do keep an eye on that if they look in pain. Again, some children are very young and they can't tell you what's wrong. So as a parent, it's our job to kind of be a bit telepathic and try and decide whether they are in genuinely lots of pain or if it is just uncomfortableness because of the heat. We've also got nausea and vomiting and irritability. So if they are being sick and they've been out in the sun or they've been surrounded by hot weather, then please do just keep an eye on that, because that can be really dangerous. And obviously, I know a lot of the time when you're hot, you don't really want to interact with people, you don't really want to do anything anyway. So irritability can just be a symptom to do with how hot they are. But if they are really irritable, then just keep an eye on that, because it could be mixed with other symptoms that they have, and it could lead to heat exhaustion, okay? Just a few more. So we've got headaches and increased sweating. Now, like I said before, a lot of heat stroke patients won't sweat. However, heat exhaustion patients, while sometimes they don't sweat, they can actually sweat a lot more than you would do if you were usually hot. Okay, so if you've laid your child down and their blankets are wet, within a little while of them laying down, or their clothes are wet, or they've got wet skin, way more than they would usually have if they were sweating, then please do keep an eye on that, because it is really important, okay? Now, we've also got cool and clammy skin. So like I said, heat exhaustion patients can sweat a lot more than usual, but their skin will be cool to the touch, okay? It won't be hot. So please don't expect them to have boiling hot skin or anything like that, because it will be cool and it will be quite clammy and quite sweaty to touch, okay? And again, their body temperature will rise to no less than 105 degrees Fahrenheit or 40.5 degrees centigrade. It won't go less than that. But it will be over that point, so just keep an eye on that. What do you do if you suspect that your child or children are suffering from any of these symptoms? Well, first of all, ring for medical attention, okay? Even if it is just a doctor to get advice on what to do, if you are immediately worried, ring an ambulance, okay? You are never going to get told off by the medical services for ringing an ambulance for a child if you are worried. So please do not hesitate. But while you are waiting, bring the child into the cool or into shade immediately. Make sure that they're not in any more sunlight, even if it's just through a window. Make sure that's not happening, okay? Undress your child, okay? Let them just lay down with no clothes on. If they are babies or they aren't toilet trained yet, it's fine to keep their nappy on. Just make sure all their other clothes are taken off. Now, the next one is make sure you're laying the child down, but also raise their feet slightly as well. And this will just help with the circulation. And make sure that if they are experiencing symptoms such as dizziness or fainting and stuff like that, it can counteract that as well. Okay. If the child is alert, and only if the child is alert, put them in a lukewarm bath or spray them with lukewarm water, okay? Never, ever, ever use freezing cold water. It can send the body into shock and the body's not going to know what to do with that, and it could actually end up making your child a lot more ill. So make sure the water is lukewarm. Only put them in the bath if they are alert. Okay, if the child is coherent, so if they're talking and they're sitting up and they seem generally okay, apart from obviously the symptoms that you're worried about, then let them sip on some cool, clear water. Okay, try not to give them juice. Just make sure that they've just got water, and make sure it's just cool. Again, don't make sure it's freezing cold. It just needs to be cool, just to sort of try and combat their core temperature. Okay, and the last one is if the child is vomiting and you've laid them down, just make sure that you've tilted their head to the side, just to avoid them choking. Again, you will get told this on the phone by your medical practitioner or by the ambulance service, and if you have rung an ambulance for your child, they will usually stay on the phone with you until the ambulance arrives at your house. So you will get a walkthrough of what to do. These are just some tips on how you can help your child while you're waiting for medical attention. Okay. Now, ladies and gents, I do hope that you've found this video helpful. Again, these are things that I learned when I did child first aid and stuff like that, and obviously research on the internet is fantastic. So if it is something that you are interested in or something that you are worried about, there is lots and lots more things on the internet, but I would say ring in your medical practitioner, your GP or an ambulance, anyone in the health service. Give them a ring, because we all know what the internet's like. But yeah, so ladies and gentlemen, if there is anything else that you would like me to do a video on, drop it below in the comments and I will make it my mission to do all of these videos for you, as long as you guys are finding them helpful. But for now, please do drop me a comment, let me know what you thought of this video, like the video, and if you can, please subscribe and click the bell as well to get notified when I drop new videos, and I will be very, very grateful. But until next week, guys, thank you so much for watching. Ta-ra!
That's what you think.